Every 40 seconds, someone in the world dies from heart disease. Not from an accident, not from something dramatic, but from a slow process happening quietly inside their body. Arteries do not fail overnight. They narrow slowly, silently, often without pain, often without warning. That is what makes heart disease so dangerous. Many people believe they will feel it coming: chest pain, shortness of breath, a clear signal. But in reality, the damage often builds for years before the first symptom appears. Doctors have known this for decades. Researchers talk about it constantly. Yet, most people still focus on the wrong things. They chase quick fixes. They trust miracle headlines. They believe that one dramatic solution will undo years of damage. Science tells a very different story. In this video, you are going to learn what actually happens inside your arteries as they age. You will learn why the word unclog is often misunderstood. And you will learn how one simple daily habit, backed by real research, may support healthier arteries over time. Not a cure, not a magic drink, but a tool that works with your body set's biology. There is a lesser-known fact that rarely makes headlines. Most heart attacks are not caused by arteries that are completely blocked. They are often caused by unstable plaque that becomes inflamed and suddenly ruptures. This is where the story changes. Because supporting artery health is not about scrubbing arteries clean. It is about calming inflammation, protecting blood vessels, and preventing damage before it becomes dangerous. In this video, we will break down what scientists actually mean when they talk about artery health. We will explain how diet influences blood vessel function at a cellular level. And we will reveal why researchers became interested in a simple drink that people around the world have consumed for centuries. This drink is not new. It is not expensive, and it does not come with dramatic promises. Yet, population studies and clinical research keep pointing to it again and again. You will learn how this drink interacts with cholesterol, how it affects oxidative stress, one of the key drivers of artery damage, and why consistency matters more than quantity. We will also be honest. You will learn what this habit can do and what it cannot do, because real science does not exaggerate. It sets boundaries, and those boundaries matter for your health. Another fact many people do not realize is this: lifestyle changes can influence artery function faster than most expect, not in days, but in weeks and months. Blood vessels are living tissue. They respond to signals, they adapt. The question is not whether change is possible. The question is whether daily choices support healing or accelerate damage. By the end of this video, you will understand why heart disease is often called a lifestyle-driven condition. You will understand how small habits quietly shape your future risk. And you will know how 1 cup a day fits into the bigger picture of cardiovascular health. This is not about fear. It is about awareness. Because when people understand how their bodies work, they make better decisions. And better decisions compound over time. If you care about protecting your heart, if you want information grounded in evidence, not hype, and if you want to learn how simple habits can support long-term health, this video is for you. Stay with us until the end, because the final takeaway ties everything together and helps you avoid one of the most common mistakes people make when trying to improve their heart health. Welcome to our channel. This is where science meets clarity. If you value calm, evidence-based health content, subscribe to the channel now, and let us begin. Artery clogging is not a sudden event. It is a slow biological process that begins deep inside the artery wall. It starts when the inner lining of the artery becomes irritated. This irritation can come from excess sugar, damaged cholesterol particles, smoking, stress, and poor sleep. Over time, cholesterol does not simply stick to the artery like grease in a pipe. It becomes trapped beneath the artery lining and triggers inflammation. The body responds as if there is an injury. Immune cells move in. Fatty material builds up. This forms what doctors call plaque. Most people do not feel this happening. Blood can still flow even when an artery is partially narrowed. The heart compensates. The body adapts. That is why someone can feel perfectly fine while serious changes are already underway. No pain does not mean no problem. Diet plays a bigger role here than many realize. Food choices directly influence inflammation and oxidative stress. They affect how cholesterol behaves in the bloodstream. They determine whether blood vessels remain flexible or become stiff. Highly processed foods increase inflammatory signals. Excess sugar damages the artery lining. Poor quality fats make cholesterol particles more likely to become harmful. On the other hand, nutrient-rich foods send a different signal. They support the protective lining of arteries. They help stabilize plaque rather than allowing it to grow and rupture. This process unfolds quietly, shaped by daily choices long before symptoms appear. The word unclogging is often used in headlines, but it creates the wrong picture. It suggests that arteries become blocked like dirty pipes and that something can wash the buildup away. That is not how the body works. Arteries are living tissue. They are flexible. They respond to signals. Plaque forms within the artery wall, not on the surface where it can be scrubbed off. Once plaque develops, it becomes part of the artery structure. What matters most is not whether plaque exists, but how stable it is. Stable plaque tends to stay quiet. Unstable plaque becomes inflamed and dangerous. Inflammation is the real driver behind artery damage. When the artery lining stays irritated, immune cells remain active. This weakens the protective cap over plaque and makes it more likely to rupture. Blood flow is affected not only by narrowing, but by how well arteries expand and relax. Healthy arteries widen when the body needs more oxygen. Inflamed arteries lose this ability and become stiff. This is why many people experience heart events without having severely blocked arteries. The issue is often sudden inflammation and loss of stability, not a gradual closing of the vessel. Supporting artery health means calming inflammation, improving vessel function, and helping plaque remain stable rather than trying to remove it. The drink researchers keep returning to is green tea, not as a trend, but as a pattern seen across decades of observation. Green tea is made from the leaves of the Camellia sinensis plant, gently heated to prevent oxidation. This process preserves natural compounds that are largely lost in other teas. What makes green tea different is not caffeine or flavor, but its concentration of protective plant chemicals. Scientists became interested in green tea after noticing something unusual in population studies. Regions where green tea is consumed daily showed lower rates of cardiovascular disease, even when other risk factors were present. This pattern appeared consistently enough to raise questions. When researchers looked closer, they found that green tea drinkers often had better markers of blood vessel function. Their arteries responded more efficiently to changes in blood flow. Inflammatory signals in the blood were lower. Cholesterol particles were less likely to become damaged. The explanation was not mystical or traditional. It was biochemical. Green tea contains compounds that interact with the cells lining blood vessels. These compounds influence how the body handles oxidative stress and inflammation, two central forces behind artery damage. This is why green tea is studied not as a cure, but as a daily habit that supports the environment inside the arteries over time. The science behind green tea centers on how it influences the internal environment of the blood vessels. One of the first effects researchers observed was a reduction in chronic inflammation. Low-grade inflammation keeps arteries in a constant state of irritation, which weakens their protective lining over time. Compounds in green tea help calm these signals, allowing the artery wall to remain more stable and resilient. Oxidative stress is another key factor. This occurs when unstable molecules damage cells and cholesterol particles. When cholesterol becomes oxidized, it is more likely to lodge inside artery walls and trigger immune reactions. Green tea compounds act as antioxidants, helping reduce this damage before it accumulates. Cholesterol behavior also changes in subtle but important ways. Green tea does not simply lower numbers on a blood test. It influences how cholesterol particles function. Research has shown that regular intake is linked to lower levels of harmful cholesterol and improved balance between different cholesterol types. Human studies provide much of this insight. In controlled trials, participants who consumed green tea regularly showed improved blood vessel flexibility and healthier inflammatory markers. Long-term observational studies have linked consistent green tea consumption with lower risk of cardiovascular events. These effects build gradually, shaped by daily intake rather than high doses, influencing how arteries respond to stress over time. Green tea is often discussed in dramatic terms, but its real value lies in realistic expectations. It does not reverse advanced artery disease. It does not dissolve plaque, and it does not replace medical treatment. Its role is supportive, not corrective. People who may benefit the most are those in the early or middle stages of cardiovascular risk. Individuals with mild cholesterol issues, early signs of inflammation, or a family history of heart disease often see the greatest impact from small, consistent habits. For them, green tea can help create a healthier internal environment inside the blood vessels. Those already following heart-conscious lifestyles may also benefit. Green tea works best when combined with balanced nutrition, regular movement, and proper sleep. It supports processes already moving in the right direction rather than forcing change. There are also people who should be careful. Green tea contains caffeine, which may affect those sensitive to stimulants. Some compounds can interfere with iron absorption when consumed in large amounts. Individuals taking blood pressure or blood thinning medications should be cautious, as interactions may occur. For anyone with diagnosed heart disease or ongoing treatment, green tea should be viewed as a conversation to have with a healthcare provider, not a self-directed solution. Using green tea correctly is less about precision and more about consistency. Research most often points to a modest daily amount rather than large quantities. 1 cup per day is enough to support the biological processes linked to artery health. Drinking more does not automatically lead to better results and may increase unwanted effects for some people. Timing plays a quiet but important role. Green tea can be consumed in the morning or after meals, when the body is already processing nutrients. Having it too late in the day may interfere with sleep due to its natural caffeine content. For those sensitive to caffeine, earlier hours tend to work best. Preparation should remain simple. High-quality loose leaves or plain tea bags are sufficient. Water that is too hot can destroy some beneficial compounds and create bitterness. Allowing the water to cool slightly before steeping helps preserve its properties. Steeping for a few minutes is enough to extract active compounds without overwhelming the system. Adding sugar or flavored syrups changes the metabolic response and reduces the benefit. Drinking it plain allows the body to respond to the natural plant compounds as intended. This approach emphasizes regularity and simplicity rather than complexity or excess. Green tea is not a miracle cure. It will not erase years of poor habits overnight. It will not suddenly unclog arteries or prevent every possible cardiovascular event. The real benefit lies in the quiet, cumulative effect of small, consistent actions over time. Daily choices are far more powerful than dramatic interventions. 1 cup of green tea a day is a simple habit, yet it can influence inflammation, oxidative stress, and cholesterol behavior in ways that support artery health. When combined with balanced nutrition, regular movement, and adequate sleep, this small habit contributes to a foundation for long-term well-being. Consistency is more important than extremes. Drinking multiple cups in a single day does not substitute for weeks or months of regular intake. Similarly, occasional lapses do not erase the benefits, but long-term neglect diminishes them. The body responds gradually to repeated signals, rewarding steady effort more than bursts of intensity. The lesson extends beyond green tea. Every small, thoughtful choice, whether it is what you eat, how you move, or how you manage stress, accumulates and shapes your internal health environment. Sustainable habits maintained over time quietly protect your arteries and contribute to overall cardiovascular resilience. If this video helped you understand how simple daily habits can support your artery health, take a moment to show your support. Like this video to let us know you found it useful. Subscribe to our channel for more science-based health insights delivered in a clear, calm way. And comment below to share your experience with green tea or any other habits that support your heart. Your engagement helps us create more videos that bring reliable, practical information straight to you.